Patau syndrome by Brooke PALL, also known as trisomy 13. Patau syndrome, also known as trisomy 13, is a genetic disorder that includes health problems that affect almost every organ of your body. They are fatal diagnosis. More than half of babies affected with the conditions do not survive the first week of life, and survivors do not usually make it past their first birthday. Characteristics and symptoms. Some disorders among both infants and young children with Patau syndrome include difficulties with feeding, slow postnatal growth, gastroesophageal reflux, seizures, apnea, kidney defects, hypertension. Infants and children may also experience scoliosis and developmental disabilities. Causes of Patau syndrome. Patau syndrome, also called trisomy 13, is a clinical syndrome that occurs when all or some of the body can contain an extra copy of chromosome 13. It is characterized by cleft lip, cleft palate, cerebral defects, anatomical semen creases, polydactyl, trigger thumbs, capillary hemangia. In the U.S., most states of trisomy 13 are detected prenatally, either by genetic screening or ultrasounds. Greater than 90% of fetus with trisomy 13 have findings detected on prenatal ultrasounds. Inheriting Patau syndrome. Patau syndrome happens by chance and is not caused by anything the parents have done. Most cases of the syndrome do not run in the families. They are not inherited. They occur randomly during conception when the sperm and egg combine and the fetus starts to develop. Trisomy 13 does not typically run in families. Occasionally, one parent may have a chromosome rearrangement that increases the chance of having children with chromosome differences. Patau syndrome causes. Patau syndrome causes retardation, cardiac and kidney malformations, and scalp defects, and more. How common is Patau syndrome? Patau syndrome is rare. It affects about 5 in 20,000 pregnancies. Only about 1 in 10,000 babies will be born with Patau syndrome. Diagnosis of Patau syndrome. Ultrasounds or x-rays can reveal an abnormal of internal organs. MRI or TC scans can reveal cerebral hemispheres are fused. Chromosomes studies have shown trisomy 13. Treatment. There is no treatment to address the condition. However, there are procedures to sustain life for a bit. Most times, surgery is required to fix defects to allow the children to survive for as long as possible. Since most infants with Patau syndrome die within the first year of life, special management and procedures are necessary. This is very complex and carefully laid out. Many children have trouble surviving the first few days or weeks of life due to severe neurologic and vascular problems. Patau syndrome prognosis. The median life expectation of Patau syndrome is 7 to 10 days, and 90% die in the first year of survival and is often attributed to monocyte and severity of associated malformations. Survival beyond the first year have been associated with monocyte. There are only 8 published cases of patients with full trisomy 13 over the age of 5 years old. There is a 8-year-old girl, 101 months of Semelian organ, diagnosed with fully trisomy 13. She is currently the 3rd longest surviving reported case of full trisomy 13 in the UK, and 8th of the longest surviving worldwide. I hope you enjoyed learning about Patau syndrome.